Global Wisdom Missions is an organization of Christian ministers from different denominations and countries dedicated to presenting Jesus personally to this generation of the young minister and leader by assisting them to fulfill their calling by following and applying the wisdom of God. Our vision is to be a global conference that raises a generation of gospel-centered, gospel-driven, and gospel-focused ministers of Christ, who shall proclaim the gospel with integrity, purity, simplicity, and without adulteration. We are achieving our vision through educating ministers and leaders through our weekly broadcast of the Wisdom Conference on Facebook and YouTube Live, which is making a global impact. Wisdom Impact Magazine, our quarterly educational, inspirational and informational magazine, which will be printed in hard copies and be distributed globally free of charge to countries and territories which may not have access to internet. The Global Wisdom Academy, an online ministerial and leadership training academy which remains steadfast and committed to carrying out God's purpose of empowering Christian ministers and leaders globally to effectively execute leadership and ministry work with wisdom. Global Wisdom Mission's aim is to proclaim the gospel in word and deed, describing the shape of Jesus' own ministry. The Apostle Peter says he went around doing good and healing all. Through missions, we seek to provide healthcare for a lasting change during our actual Global Wisdom conferences in different countries with our skilled medical physicians, experienced surgeons, and professional health workers. Partner with us now and help us spread the gospel of Jesus Christ around the world and take it to places where you may not be able to go yourself. Together, we can make a difference.
Thank you. Good afternoon and good evening to our viewers from all around the world. This is Professor Jonathan Laye coming your way once again with Wisdom Conference Time with the Doctors. And today we have an interesting topic for you. This is something that you may not think about. This is something that you may not talk about, but a very, very important topic indeed. We're talking about dental health. So when we talk about dental health, we're talking about the mouth and the teeth and all the structures within the mouth. And many people may not know this, but as your dental health or your oral health goes, so your whole health goes. And it has something to say about your entire personality. And so today we are privileged to have two distinguished panelists, to help us sort through these. And I would love for you to indicate where you are watching from in the chat. So there are some watching from Facebook and some watching from YouTube, but tell us which country you are watching from. And if you have any questions, you can post them and we will be sure to answer them for you. So I will go over to our panelist, Dr. Sandra Hewlett, to introduce herself, and then Dr. Uvo will introduce himself after that, and then we will dig in.
Okay. It's great to be here, Jonah, and good evening, everyone. My name is Sandra Hewlett. I'm a lecturer at the University of Ghana Dental School. I'm also a practicing dentist for over 20 years now, and I'm great to be here. Thank you.
Hello, everyone. My name is Dr. Uvo Noriabe, a dentist trained originally from Nigeria, currently in Michigan as a prosthodontist. I also serve in the United States Army as an officer in the Dental Corps. It's a privilege to be here. Thank you so much for inviting me.
Thank you, and welcome once again. So we are going to dig in and go straight to our topic. So I'll start with you, Dr. Noriabe. So when we talk about oral health or dental health, like what do we mean? What are we talking about? Can you give us a a synopsis of that.
Yeah, I want to. So the Federation International of Dental Federation has a definition that encompasses everything. So when you talk about oral health, essentially you're talking about your ability to speak, your ability to smile, your ability to smell, your ability to taste, chew, swallow, and convey a range of emotions through your facial expressions with confidence, without pain, in terms of a good oral health, without discomfort and disease. So it's a complex of the head, the face, and the mouth. So it means the entire complex. So when you break it down, you think it's just the teeth, but you're talking about all the surrounding structures. I do have a photograph here. I'll see if it's possible for me to share the screen. But for right now, that is it encompasses everything: your teeth, your lips, your gums, your tongue, your muscles of chewing, your mouth and your throat, all the linings, your salivary glands, your head, all everything around the head and neck. If it's okay, that is what oral health, as the definition has been expanded to involve.
Thank you so much. That's a very comprehensive definition, and it looks like that explains what I meant by, as your oral health goes, so does your whole health and your whole personality. So, Dr. Hewlett, so we want to dig in now. How do teeth develop, and what are the uses of the teeth? I mean, we know we use it to chew, but are there any other uses of the teeth?
Okay, so the teeth develop when you're in your mother's womb, basically. So by age 3 months, 4 months of gestation, the teeth have started forming. And they usually will start as a small bud, and then it grows bigger, and then it gets calcified. But it stays within the confines of the jaw, even when you are born. So as at the time you are born, there are no teeth showing, but they usually are tiny within the jaw. By age 6 months, they start erupting gradually, and they erupt one after the other. By the time the baby is 2 or the child is 2 years, all the baby teeth or the primary teeth have formed. And then around 6 years, you also start losing the baby teeth, and then the adult teeth also coming. So by age 14, 15, by 18 to 20, all of the adult teeth have formed, basically. And what are the teeth used for? Several things. The most important function basically is for chewing. We know the teeth are the hardest substances in the body, and so basically for chewing food and all the things that we eat. The other very important issue is also for aesthetics. Usually when somebody smiles, the first thing you see are the pearly whites. So it's very important, not only for the you see in the teeth, but they also support the face. So that usually once you lose them, the muscles of the face tend to collapse. So for aesthetics, the teeth play a very vital role. They also help you in speaking. So as you're speaking, it helps you pronounce certain sounds or make certain sounds. So it's very, very key that these are some of the most important uses of our teeth. Thank you.
Thank you. So I come back to you, Dr. Onoriabi. So are there different types of teeth? And what on average, how many teeth does the average adult have?
Just like Dr. Hewlett said, when the child is born, he develops some teeth. So at childhood, you have about 20. If it's fully grown, you have 20 teeth for the children. That's their baby teeth, like we call it. Some people call it milk teeth. Some people call it deciduous teeth. Then as you grow, once you move from just that child, you get to a stage where things are mixed up. You get to a mixed dentition where you begin to have your adult teeth and your baby teeth together. So after the age of 12, thereabout, you have mostly only your permanent teeth. An adult has 16 teeth on the top and 16 teeth on the bottom. So you have 32. So that is what is tend to be normal. You also have extra teeth. Some people have extra teeth. Other than the 16 on the top and the bottom, they have supernumeraries where they have Some people have like a ton of extra teeth, so those are the types of teeth. You have the deciduous teeth and the permanent teeth. But in terms of how many types of teeth, you have 4 types of teeth in your mouth. You have the incisors, you have your canines, you have your premolars, and you have your molars. So you have 4 types of teeth for every person. Even the babies have little small molars, the canines, and the incisors. But the adult has 4 types of teeth for the permanent teeth.
Okay, so maybe whilst you're on this, we use the term wisdom teeth all the time. What is that?
Yes. So the wisdom teeth is typically the first, or I would say maybe the last teeth at the back of your mouth. So you have 4 wisdom teeth, 1, 2, 3, 4. So the 4 are the extreme, which some of them, sometimes they don't grow out, or they are covered by the gums and they begin to irritate you, or they grow in a very funny position that requiring them to come out. And sometimes a cyst could form if it's not properly grown. So those wisdom teeth are, most people have, like for me, I was offered by my dentist to take out my wisdom teeth. I'm like, there's nothing wrong with it. I'm going to keep it. So most children have their wisdom teeth taken out if they're having problems with it. But generally, I think, the wisdom teeth are 4 of them.
All right. So I come back to you, Dr. Hewlett. So what are some problems that can affect the teeth? And, as you talk about them, how common are these? And are they more common in certain parts of the world or not? If you can address it that way.
All right. So several problems can affect the teeth as they erupt, and they may come in different forms. The most important or the most common one that we come across is the tooth decay or caries, and this is usually where the tooth is a calcified structure. So sometimes you realize that it starts demineralizing and it gets soft, and you develops a hole. And over time, this hole gets bigger and bigger if nothing is done about it. Then it starts getting painful, and then it can develop into an abscess. You can also have gum diseases or pain with the gums, or it may start as a reddening or a swelling, then it starts getting painful. It bleeds when you brush, and then over time the tooth starts shaking. You lose bone around the tooth. This we call gingivitis, which can progress to periodontitis. In this case, the tooth starts shaking and you may lose the tooth eventually. Okay, it's also a very common thing that can arise, and it happens quite a lot, especially in our African setting. Caries didn't used to be that common, but now because of our diet changes, we in the African sub-region are tending to see a lot more of caries than we used to. So I think we should up our preventive game when it comes to this. Then there's also tooth loss itself. Over time, sometimes you may also suffer some trauma, or due to the effects of either caries or gum disease, you may lose the tooth, and then the patient becomes, you call it dental loss, so you lose that tooth. Then there's also tooth surface loss. But the surface loss, it may come in different ways. Either there's erosion, where you're having acidic things eroding the surface of the tooth. And this may come in the form of either the diet we are taking or certain diseases like gastroesophageal disease, or even pregnancy. When somebody is having vomiting during pregnancy, a lot of acidic content is released, and therefore the tooth surface wears off, or we lose those. Another thing that we see when it comes to tooth surface loss is, sometimes when you use your toothbrush or you're using certain habits that wear the surface of the tooth, over time you lose some of the tooth surface enamel, and if it gets really bad, you tend to lose a dentine tooth. Then there's also attrition, and we also may sometimes have trauma. So somebody falls, breaks a tooth, or chewing something, it cracks. So those are some of the common problems or common things that can affect our teeth. Thank you.
Okay, thank you. It looks like there's a lot of things that can affect the teeth. I'll come to you, Dr. Onorobi. So the question is, why do we need to brush our teeth? And what is the best way to brush the teeth, right? Some people use soft or firm toothbrushes. Some people use chewing stick. Some people use chewing sponge. And the question is, how often should we brush our teeth? So first address the why, and then What's the best way to brush the teeth, and how often should we brush our teeth?
All right. So I'll start with the reason you brush your teeth is that every time, by the time when you go to bed and you wake up, you notice this your teeth is kind of rough. You rub your tongue around it. So plaque develops, bacteria and saliva forms a substance on your tooth that gets stuck to your tooth. So that's what you want to brush. That's what you're actually brushing off, other than food or stains. So that plaque is what that plaque is a bad guy. That's the one you need to brush off and make sure you get all the surfaces and around your gums, because that's the precursor to disease. So if it remains on your teeth, then it brings other bacteria. They start calling each other, please come, there's food here. let's meet at this junction today. So if you don't brush it, there's quorum sensing. They are calling all their friends, and they are just forming a colony on your tooth. So when you brush, you can feel it. It becomes smooth. If you don't brush, obviously, when you wake up, nobody tells you, your mouth begins to smell, because all that bacteria and the food, the little breakdown, and your mouth begins to smell. So you want to keep your mouth fresh. You want to keep it free from disease. So you're using a toothpaste or a toothbrush. I grew up using chewing stick. My grandmother uses chewing. She used chewing stick all her life. I mean, she had most beautiful teeth. But obviously, today we know that there's fluoride-containing toothpaste that can help with making sure that your teeth is strong enough to resist all the things that are going on in your mouth. So a good toothbrush that is, I would say, medium, because you have some very hard toothbrush and some very soft toothbrush. Will that be able to take out all the bacteria that is resting in your mouth? So a medium toothbrush is what you should use, and you probably want to go in circles. You want to brush along the gum line, because that's where plaque stays. Plaque stays on the surface of the tooth, on the top of your tooth, on the occlusal surfaces. Plaque hides there. So when people eat, sometimes, how often should you brush? Some of us have to brush every time. I brush every time I eat. If I have it, I just kind of just knock it off and just let it go. But at least twice a day for at least 2 minutes. It's just twice a day for 2 minutes. 2 minutes. Some people brush, especially my kids, and they're done. I'm like, what did you just do? You got to take your time, go around in circles, follow the gum line, and around the gums a little bit as well. Especially for children who have no teeth here, but there's bacteria in the mouth. So you want to just use whatever. For a small child, you probably want to use like a gauze, or there are some tooth bristles they have now for kids that can go on the gum line, so they get a sense of cleaning. So twice a day for 2 minutes with a fluoridated toothpaste. Okay. Everybody has different, preferences for toothpaste, but something with fluoride is always helpful.
Okay. So how about, we have all these like kind of electric, toothbrushes, and then sometimes there are these kind of water jets.
Waterpik.
Yes, right. Waterpiks and stuff. Can you say something about those?
I mean, especially for those who find it kind of lazy, just not be able to brush. The brush, especially for those who want to go all the way to the back, the electric toothbrush is fantastic. It doesn't have to be very expensive. It can go all the way to the back, and it's moving. Like I said, you're supposed to make circular motion. This is already making those circular motions for you. And all you need to do is just to turn it around and make sure it gets to all the surfaces. Some people, they find it difficult because maybe they had a stroke or they had some difficulty using their hands. So you're using a Waterpik is really, really, especially for the elderly patients that I see. I advise them to use the Waterpik because they can't even get there because they don't have, maybe they had some issue with their hand or something. So it becomes easy for them to at least remove. And one thing I left out is flossing. I try to floss before I brush, because your floss can get to where your bristles of your toothbrush can never get. So your floss is able to go down and just knock off anything that is stuck to your tooth. So using floss first, then you brush, or either way, it depends on your routine. But using floss in addition to that is the right way to do it.
Okay, thank you. So Dr. Hewlett, kind of staying on the issue of brushing and cleaning the mouth. Should we be brushing like the gums, the palate, the tongue, or the sides of the mouth? I mean, is it just the teeth that we need to be brushing, or do we need to think about the whole mouth?
Absolutely essential. And like Dr. Honorabi said earlier on, the plaque is what we are trying to get rid of. So it's very essential that every part of the mouth should receive a cleaning. It's like oral hygiene basically. So all of those have to be done well. The brushing will do a lot of it, and like he also talked about flossing, it will also cleaning between the teeth and around the teeth and the gums. However, with the tongue, you realize that the surface of the tongue has these papillae, or these rough things that are sort of like little bristles on the surface. Now, usually once we eat, this plaque also helps stays there. Oral bacteria, all of these, they stay there, and they also have to be cleaned. Now, this is sometimes very difficult if you use your brush. Some people believe that the brush just spreads. If you just brush the surface of the tongue, the brush just spreads the bacteria on the surface and doesn't actually remove it. So they recommend you using a tongue cleaner to actually scrape the surface of the tongue. That way, you're getting rid of debris, dead tissue, dead cells. And it's very important because it's been noted to be a very important source of halitosis or smell in the mouth. So it's very important that in our daily oral hygiene practices, we add the cleaning of the tongue to it. If you don't have a tongue cleaner, some people just recommend just a spoon. Just use the back of the spoon and dedicate one spoon to it and use it to clean the surface. It will clear up the dead debris, clear up the dead tissue. And it's a good example if you note, for those who have either they are ill and haven't been eating very well, or even when you're fasting, you realize that there's always this whitish film on the surface of the tongue. If you notice that there's a layer on the tongue, it tells you haven't been cleaning it very well. And so it's a very important thing to do. Yeah.
So, go ahead, just finish.
And then also all the other places, the lips, once you finish brushing, rinse out and make sure that there's no debris hiding anywhere in the cheeks and the sometimes your brush can go far back, especially in the throat. So sometimes you can wash out or gargle out, so just so you get to the back of the throat to rinse out and get stuff out.
So my question is, let's say, someone who lives in a region where they don't sell tongue cleaners, but they use the chewing sponge. Does that do a good job of cleaning the tongue?
Like I said, we hardly ever use the sponge in cleaning the tongue anyway. But like I said, even with a brush, it just does the smears it around. It may get rid of some of it, but not all. It's like when you have to get rid of dead tissue, the chewing sponge may not be effective. So you can get any hard, or even may even be like a flexible rod that can be bent. Just use it to scrape anything that can scrape. So like I use the example of the spoon, or we can adapt. You can find things, anything that can do this. The scraping of the tongue will help.
Okay. I think, my next question was going to be about babies, but I think Dr. Honorabi kind of addressed that already. So, Dr. Hewlett, let me ask you this. So sometimes, as you guys talked about, okay, there is two sets of teeth, right? The baby teeth and the adult teeth. Sometimes we see children, getting braces, even when their permanent teeth has not come out yet. Can you talk about that? Is that something that's necessary? Is it needed?
Okay, so braces serve different roles, and sometimes in the primary dentition, even with the baby teeth, braces play a very huge role to make sure that the ultimate dentition, which is the final or secondary dentition, turn out good. So sometimes some babies have certain habits with the primary, there's certain habits that end up making their occlusion bad. For example, some may have a tongue sucking habit, thumb sucking habits, or maybe a tongue thrust, or any of those habits, certain habits that affect your teeth. So sometimes your dentist or your orthodontist may recommend certain, it may not be, I'm using the term braces in a layman's way, but they may have certain appliances to be able to do either correct the habits, or sometimes some children may lose their teeth prematurely. The teeth by themselves also act as a space maintainer for the secondary teeth that are developing. So if you lose your baby teeth prematurely, that space may be lost by the time the permanent teeth are coming out. And when they do that, by the time the permanent teeth come out, they may not have adequate space to be able to easily align. So sometimes your dentist may decide that they're going to create an appliance referred to as a space maintainer that will also hold the space so that the permanent teeth will have space to move in. Or sometimes to the patient, the baby may have what we refer to as cross bites or malaligned bites, and the correction may have to be started even whilst their milk teeth are there, so that the effect is reduced in the permanent teeth. But having said that, it is all in a transitory thing. It will still have to be determined when the secondary teeth have all come out, whether that treatment was enough or was just to augment what the permanent one and the final outcome should be. But it does happen, and it's also very important. And to do that, I also recommend that it's always good to see a specialist, somebody who's an orthodontist or pediatrician who will advise what the best treatment should be. Thank you.
Thank you so much. So Dr. Onorobi, so let's move on to cavities.
Yes.
When Dr. Hewlett was talking, she mentioned cavities, and I think we hear about cavities a lot. So what are cavities and why are they important? How are they treated? And then as you talk about it, can you answer the question? When we were children, we were told, you know, if you eat too many sweets, you will get cavities. So address that if that's true.
You know, anyway, cavities are, I guess, they are the first things that drive people to a dentist. Basically, it's a hole on your tooth. So it could be on the surface on top of your tooth, or it could be by the side, and it could be it's the main reason. It is the main reason. You know, you have a little. It starts really small. I guess by the time it starts, people don't notice it. By the time you get to the dentist, it forms a hole, becomes cavitated. So initially, it starts as a non-cavitated lesion. So when it starts initially, it's just on the surface. Then it gets bigger. So there's a lesion on the surface that is really slight. Then if it gets bigger, it goes through. So I know we're talking about the tooth. The tooth has an enamel, it has a dentine, and it has the nerve, the pulp. So those three layers is where your cavity is heading. Your cavity is actually heading for the nerve. That's the goal in life, that I want to get to this nerve so that you start having some toothache. So it starts as a, you know, so what happens is, we said our friend we don't like is the plaque. So the plaque has a lot of bacteria, and all you need with that is some food. Just give that bacteria some food and some time and some surface, and you know, a cavity is going to form. So if you leave the bacteria there long enough on your tooth surface with food, then a cavity, so it begins to break down your food and releases some acid, and that acid begins to dissolve that very hard substance in your mouth that is so hard, but you know, the bacteria is able to start eating it away slowly. So that's how it starts. So, you know, in taking care of it, you can start early in terms of it gets to a point where it is just the mineral that has been taken out. So you can actually remineralize your teeth if you catch it early enough. But when it becomes a cavity, then we now want to intervene by removing all the bacteria and filling your tooth back with a substance that is similar in properties to your tooth. But by the time it gets past the dentine, it now starts getting to, I guess we're going to get to abscess later on. But once it gets to your nerves, you know, then it becomes a different ball game. You start thinking about how we're going to take out the nerve and deal with that. So it's in stage. I guess when we talk about abscess, we can actually discuss a root canal treatment. So you can actually do a filling. You can give a mouth rinse to bring about remineralization of your teeth, or you could do dental sealants. You can prevent it. These things are preventable because some people have we all have different anatomy. Some people's their grooves on their teeth are deeper than others. You know, so when you're eating all this sugar, you know, so this comes to our candy. So candy is just going to sit down in the groove. Then the bacteria is just going to say, yes, here we go. You know, and if you have time, so if you take a lot of candy, if you brush it out, I think you'll be fine. You know, I think if you brush it out but it means that the frequency of all this sugary stuff also, is a risk factor for developing a cavity. So if you're taking it a lot, you're drinking Mountain Dew, especially for the adults, Mountain Dew or something sugary, and that's how cavities form.
That is great. It's good to know this. So whilst we are putting a lot of sugary stuff in our mouths, we are just feeding the bacteria if we don't brush it out, soon after. That's great. So Dr. Hewlett, so now one of the probably most painful things that people will talk to you about is a tooth abscess. What is that, and how does that come about, and how is it treated?
Okay, so like Dr. Uvo talked about earlier on, the target is to get to the nerve. Now, when you haven't done anything, he gave us the easy ones. When it's before it demineralizes, so you can easily remineralize and it's fine. Then it gets into enamel. You can still do a filling, it's fine. It gets into dentine. You can still do a filling. The patient is okay, or the person is okay. However, if we don't act on any of these steps and it keeps progressing till it gets to the nerve, then bacteria now have free access to the nerve and its contents, the pulp, the blood vessels, and everything. And sometimes it doesn't stay in the tooth. It goes and exits from the root of the tooth. And then an abscess forms. An abscess is just a collection of bacteria or pus. It's like you having a little boil. Unfortunately, when you have a boil, it swells. So there's room for swelling, and then it bursts. And once it bursts, you're fine. In the tooth, however, the tooth is a hard shell with a casing. So there's no room for the swelling to occur, for it to burst, for you to have relief. So usually what it is the infection tracks all the way down. And sometimes you may have a boil around your cheek, like where the root of the tooth is. And that can be extremely painful. That's what we usually will wake them out and some up at night, and people will walk into a clinic and say, pull it out. No matter what you say, they say, pull it out. Still, sometimes, depending on where it tracks, it can go to very dangerous areas and spreads, and sometimes it can even lead to the death of the person. So it's very important that we take these very seriously. Once you're having toothache and it's painful, don't wait for it to progress to that point, because treatment is more complex and it also gets more difficult. How do you manage these abscesses? Like he said, like Dr. Alva said, there are only two options. Either we're doing a root canal filling, which is taking out the nerve and the pulp. So the filling is no longer just within the shell of the tooth. Now you have to go all the way down into the root to treat it, to make sure you've gotten rid of the abscess and the infection before you fill it. That's a bit more complicated and more expensive too, so you don't want to get there. The other option is to extract the tooth. Once you pull out the tooth, you get rid of the infection and the area heals. But once you pull out the tooth, especially an adult tooth, you're not going to get it back again. So it's better to prevent it from getting there. Thank you.
Thank you. So, Dr. Onorobi, so we talked about, some problems with the teeth. How about the gums? What causes gum disease, and how is that treated? And the other thing is, sometimes we see people where the gums are receding, and so you're seeing kind of the base of the teeth. What causes that, and how can that be treated?
Yes, the gums generally, so the tooth is anchored in bone, and around the tooth you have ligaments and some tendons, and you also have just soft tissue. So all that complex is how gum disease progresses. So it starts. So all that so initially, once gum disease starts, it starts as a swelling that is red, that is painful, and like doctor said, it begins to bleed when you brush or when you floss. And sometimes you have those receding, the gums are pulling away from the teeth, causing them to look longer than normal. Or you have your teeth begin to get loose, or there's pus, around your gums, and there's sores in your mouth. And it's all from, like we said, there have been so many classes, but bacteria is the same. Bacteria is the chief culprit. And sometimes even if you get bacteria, you can't even solve it because there are so many risk factors. There's hormonal issues with certain people, there's smoking, there's age, there's even your genetics. Some people just have gum disease because it is transferred. You find it more in certain groups of people than others. If you go to the Indian Americans, you can find a whole ton of, they're given the same conditions, but they will develop a gum disease more. So in terms of the gums are affected by plaque. And when you start looking at, I want to read out some of all the, so you have age, like I said, smoking and tobacco use, stress, medication, grinding, poor nutrition, obesity. So there are so many other, not necessarily causative factors, but risk factors that are associated with gum disease. And obviously, it starts as just inflammation of the gums, which is gingivitis. Then once it starts affecting the other structures, like the bony, then you now start having periodontitis, which has been, there are so many classes, many stages. In fact, the periodontists, they meet every year to change every definition. In fact, last year they came up with a new one, and I think nobody can escape it. In terms of, do you have diabetes? Do you have any other thing going on with you? Are you pregnant? Even the pregnancy of, pregnancy has hormones that you can see in the mouth. Do you have any other disease going on with you? The first time I saw HIV was in the mouth. If you look at someone, if you know what you're looking for, you see HIV, it shows you right there, staring at you in the mouth. So the mouth becomes a mirror of your body. And gum disease is something to be taken care of. If not, you can actually, today, as a prosthodontist, I treat gum disease by taking out all the teeth because there's no more bone and there's nothing we can do to save it. And people lose all their 32 teeth are taken out because they could not manage the gum disease. So it's really, really critical. I think, we should come back and talk about gum disease. It needs a full day. If we break it down, we're not going to leave here today. And it's fun taking care of it because there's all kinds of research going on in terms of what can be done to prevent and to keep things healthy.
Okay, thank you so much. Dr. Ovo mentioned flossing. Dr. Hewlett, can you kind of explain what really is flossing and what's the best way to do it?
Okay, so, we've been talking about toothbrushing and its importance and removing of plaque and food debris around the teeth and the gums. Now, your toothbrush will effectively take out the plaque from around the teeth, in front and behind it. However, the toothbrush is not as effective in getting rid of the plaque and the food debris in between the teeth. And so if that is also not taking out, the spaces in between or the junction in between the teeth becomes a good focus for the bacteria to hide and do their destruction. So because of that, it's very important that we floss. What the floss is just a little like a thread-like thing that goes in between the teeth and does the cleaning in between the teeth. It does it effectively by just as you clean back forth, it cleans in between the teeth and it reduces the risk of caries. Because remember, Dr. Ovu said you need bacteria, you need food, you need time, and you need the tooth. Now, an area where they can easily hide is in between the teeth. The bacteria will hide there, the food will hide there, and your toothbrush may not easily reach it. And so the flossing is very important so that once it does that, it takes out all of this and prevents gum disease and also will prevent caries. It will also ensure that it reduces the soreness and puffiness. So it's very key. It's a very important aspect of it. We recommend that we floss daily so that even if you can't, at least pick a time during the day. And as you're going back around your normal duties, go around in between the teeth. And it's difficult because you remember you're supposed to go in between each of the 32 teeth. So it's a little bit of work. So you need to go around, back, forth. Right now, there are different types of flosses. There's a threaded one. There are some that are already threaded. So it comes in a little holder. So you can makes it easier to reach. For some very difficult areas to reach, your floss may be difficult, especially at the back where your wisdom teeth and all those other teeth are. Your floss may not get there. So sometimes they are interdental brushes. They are just like a toothbrush, but it's just a single tuft brush. It's just a single thing that goes in between the teeth so that it helps you be able to effectively clean in between. Because over time, like you're talking about gum disease, one of the key areas, in the areas where you're getting a lot of gum disease, is there where your brush is not reaching. So it's a very important aspect of our oral hygiene care that we need to take seriously. Thank you.
Okay, thank you. So, Dr. Onorobi, you mentioned fluoride in toothpaste. Kind of how essential is that? And what should we be looking for? Now, there are all kinds of toothpaste. So as you talk about fluoride, I want you to address this. You see all kinds of toothpaste. I mean, some of them will say maximum plaque removal. Someone will say maximum whitening. Someone will say, they say all kinds of things. Is it just a trick, or how important is fluoride, and what are all these different types of toothpaste?
I think it depends on so many people that there's a group called anti-fluoride, so so they have their products where there's no fluoride at all and they think they're going to be okay. But in terms of I think fluoridation in our drinking water is supposed to be one of the advances of science in our generation. So it's something that was done to prevent decay. So if your toothpaste has, so each of all the fluoride toothpaste you see there is all about marketing. Somebody's trying to sell something. Somebody's trying to sell something, and each of them has a different level of fluoride, amount of fluoride inside. Some of them have no fluoride at all. But I think if you are trying to buy something that has at least some fluoride. And we never used to look at all the things that we buy. But if you go to the store now, today, just go to the store and take a look at all the fluoride. They have different concentrations. So some of my patients, we advise them to get something that is even more than the usual because they have a very high caries risk. They have decay in all their mouths, so we increase their fluoride. But for a regular person, just any amount of certain parts, million, 0.7 million parts, that it comes in, that should just be enough for anyone who needs. So something with fluoride for sure. But anything without fluoride, you are almost, especially if it's not in your drinking water as well, you're going to have a lot of decay. And and that will lead you to toothache and tooth loss and different type of problems. So anyone, I think, from Colgate to, they all have, all the marketing people know what is a good product. So if you look at it, they all have almost the same type of ingredient inside, but they will market it with a different flavor. Or maybe I added baking soda to it to make it whiter. Someone's going to tell you, oh, this is good for your gums as well. So they're all trying to sell something, but basically fluoride, it should be in your toothpaste.
So and I see some toothpaste that have charcoal in it as well. Is that just
yes? In fact, my daughter, we had a discussion the other day. She's like, because what it does, over time, it kind of wears off your enamel. So after a while, it's going to be sensitive. Or you might make it white. My grandmother used to use charcoal for her teeth. Yeah, and a chewing stick, but like that was so many 30, 45, 50 years ago. Today they're good material, but people are pushing that charcoal toothpaste. But I don't know how much fluoride is inside. I don't think so, but I know it wears away, and from what I read, some review, it causes sensitivity after some time.
Okay. So Dr. Hewlett, Dr. Onorobi mentioned kind of fluoride in the water, like fluoridation. I mean, how important is that? And for people who live in areas where maybe the water is not fluoridated, I mean, is there something they can do?
Yes, so I think over time, research has shown that the fluoridated water is the most effective way of getting fluoride across. Because in certain areas, some people may not even have access to toothpaste to be brushing their teeth or fluoridated toothpaste. And you also have other options like milk, salt, and to get fluoride to these ones. So over time, they've talked about water being the most, fluoridated water being the most effective, because everybody's drinking water anyway. And once they are drinking it, it's also having a topical effect, and also it goes through your body. So it's a systemic effect. So it's more effective. However, for people who don't have it, sometimes we may recommend, it becomes a political thing. You can have your the government introduce it either through their tap water system so that everybody gets it involved. In Ghana, sometimes a lot of our streams and our water bodies, the wells, they tend to have a lot of fluoride in there. To some extent, that sometimes it's even over what the normal level should be, which is about 0.7 parts per million. So sometimes they even have complications of having excess fluoride. But it depends on the level. It could be the dentists in the area it becomes like a policy thing where they'll have to decide what we're going to add. But personally, I wouldn't recommend to add fluoride to your water or anything, no, because you may not know, you may not be able to measure what could be ideal or not. So it will be something that the government or the policymakers in that area should research on and decide and do. But it's the most effective, because if a child is not brushing well, or you don't have access to fluoridated toothpaste or the other ones, at least with the regular water, you can get it across to everybody. So it's a very effective way of getting fluoride to everybody.
So, Dr. Nairobi, so how about mouthwashes? So, we get all these different flavors and shades of mouthwash. Are they important in oral health?
I think anything that has fluoride or kind of helps to reduce the bacterial load. So the bacterial load that's the target. So you have a lot more fluoride. So you are bathing your mouth with a lot more fluoride, and the fluoride allows the body to use calcium on phosphate to make your teeth stronger. So each of those contain maybe like sodium fluoride. I think it's always a good thing. I have a mouth rinse in my mouth, and some of our patients, we prescribe for them, like Peridex, because they need it. They need that, because what Peridex does, it can actually reduce the amount, just the amount, the bacteria, the infection in the mouth. So for those who have gum disease and have a very high caries risk, it's a prescription for them. So, but generally, like a regular person, as far as you are brushing and just doing your rinses, you should be fine. So I wouldn't say, mouth rinse is like, something, if you don't have it, you're not going to do. But if you are not brushing and you're not brushing your teeth with your toothbrush, with a fluoridated toothpaste, I think you'll be in trouble. But for a mouth rinse, you can use it. It's an adjunct. It just adds to what you're doing.
Okay, so I may be a little mistaken, but I may have read somewhere some dentist who was saying that not to use a mouth rinse together with brushing. I'm kind of remembering it faintly. So if you are going to be using the mouth rinse, what time should you use it? I mean, in relation to when you brush.
I mean, I've heard that before, especially when you're using an acidic, a fluoride mouth rinse that contains acid, like Listerine, which is really harsh. So it kind of takes away your enamel. So that's acid you are introducing to your mouth. So there's new products now that has no acid in it, that does not have that component. So I understand, okay, you're using Listerine and you just finished brushing, and obviously it can wear a little bit of your enamel because it's acidic. But if you are using something that is not acidic, I don't see any reason why. So there are different school of thoughts. But that acidic one, Listerine, it gets really, really harsh. Sometimes you really have to dilute it. If not, it just keeps doing its work.
Yeah. Okay. So, Dr. Hewlett, I mean, is there something different that is used in Ghana, for example? Or is it the same thing?
Well, it's the same thing, but over the times, I've also noticed that we've introduced a few herbal mouthwashes that people try to use. Over time, people try things and they tend to work for them, like the neem tree, and they claim it does whatever. So some mouthwashes have been used, but like Dr. Over said, they are just basically adjuncts. The most effective way of getting rid of the plaque is to actually do the mechanical removal. And these mouthwashes act as an adjunct. And sometimes some people feel like when they use them, it freshens their mouth. So just a way of freshening their breath. So that's kind of...
Okay, so Dr. Hewlett, how about dental sealants? I think when Dr. Ovo was talking about the cavities and stuff, or you also mentioned something about sealants. What are they and what's their role?
Yeah, so earlier on, he talked about the grooves on the surfaces of the teeth and they predisposing you to decay or cavities. Research has shown that usually those grooves act as an area where decay or where the bacteria stays, food also stays there easily. So it's like a beautiful niche where they are and your brushes are find it very difficult to get rid of some of those areas. So one of the things to do is sometimes once the tooth erupts in children, especially when they are now very susceptible to these acid attacks and to the decay, it's suggested that we clean these grooves out and then fill it. It's a very thin film of resin cement. It's like a little, the cements that we use, except that it's in very thin films. Flow it over the surface of the tooth so that it becomes like a barrier to these acid attacks to the tooth. And it's been found to be very effective in reducing decay and cavities. So once the teeth erupts in the patient, in the mouth, usually by 6, 7, 8 years, and also for their children, you do it and we place it in them, and it reduces the risk of decay.
So is it helpful in adults as well, let's say, to prevent decay, or is just for children?
Routinely, because adults over time, their grooves are not, for some adults who have very deep grooves who do that, but over time, if they are predisposed, they are high risk to getting decay, we do that. But generally it's been done for children. But for adults who are at very high risk, or maybe they have certain peculiar issues because of that, you're going to put those in their fissures to prevent the decay.
Okay. So I think Dr. Uvo, you may have answered this question already, but if you can just brush over it. It was about receding gums, but I think you already kind of talked about it.
Yeah, I'm listening to add to that. Some people have receding gums by just the way they brush, just their habits. Some people have receding gums from, there's a lot of prosthesis people put in their tongue rings. People put a lot of tongue, metal things in their mouth just for fashion. Or whatever, but that acts. I've seen anywhere you have that, gums recede. And if you have your brushing technique, some people are like really doing it. And once you're doing it, you're kind of you're pushing your gums away, and it can recede. And if you have gum disease, for sure, that is one of the signs that you can see the tooth gets longer, and obviously leads to what we're going to talk about next.
Yeah. Okay. So, Dr. Hewlett, some people have very sensitive teeth. What causes that, and how do we kind of treat that?
Okay, so there are several theories concerning why and how sensitivity occurs. But generally, like Dr. Uvo described earlier on, the tooth is a hard shell with enamel around it, and then it's covering a dentine underneath it, which is also protecting the pulp. Usually with time, we've noticed that when you have situations where the enamel has worn off, and unfortunately, enamel, it doesn't regenerate, or you can't get it back. So once the enamel is worn, it's gone. So where you have situations where the enamel is worn and the dentine is exposed, then people start getting sensitivity. They are predisposed to hypersensitivity. And this is where you have this sharp, fleeting pain it's usually thermal stimuli. So let's say hot, cold, or maybe some chemicals like acidic things, like you eat pineapples or fruits. Then you realize that you get a lot of sensitivity to these things. They can happen sometimes. Over time, we realize that some people are predisposed more to it. As we age, you realize that there's more wear, so dentine is exposed, you get predisposed to hypersensitivity. Individuals with also periodontal disease also have a higher risk of sensitivity. This is because, remember, in our description, we said when you get periodontitis, there's receding gums, or the gums are peeled away from the tooth, so the dentine is exposed, which predisposes them to hypersensitivity. And also where there may be abrasion or enamel surface wear. So all of these will predispose some people to generally to hypersensitivity. So how do we manage it? Generally, one of the ways to do it is to do topical fluoride. Fluoride helps a lot. What the fluoride does is it blocks those tubules in the dentine that and under normal circumstances are open and cause the hypersensitivity. So once you use the fluoride over time, it improves it. So sometimes somebody will tell you use toothpaste, let's say Sensodyne toothpaste, or all those other things. What they do is they block those dentin and stops the hypersensitivity from happening. Your dentist may also recommend that you apply a varnish, or sometimes they may even apply a filling. They put a filling over the dentin that is exposed, and that does a lot to reduce the sensitivity in this case.
Okay.
I just wanted to add,
sure.
Sometimes most of the patients come in without any sensitivity, and they come in and they get a filling done, and they're back the next day. That, doc, my tooth was okay, but by the time you did your procedure, so composite fillings, so that is iatrogenic, caused by the dentist, just because of the technique and the procedure. If you don't keep things, you don't keep saliva away, if you don't keep things, cured in a certain manner, you could open those dentines, those tubules will be open just a little, because you don't see it with your eyes once you're working, but those holes are there. So if you don't cure it properly, then the patient is going to and say, okay, I have some sensitivity. At that point, we kind of apply, there's an anti-sensitivity agent, Gluma, that we apply on the tooth to make sure that that thing is blocked. If not, the patient, it's a nightmare when the patient comes back complaining of what you did. That happens. And I also ask them to expect it. It's going to be sensitive for some time, after which it's going to go away. That way, it kind of makes them rest assured.
So, Dr. Uvo, so what are the causes of tooth loss? I mean, I know sometimes we go to dentists to extract the teeth, but some people lose their teeth by themselves without the help of a dentist. So, what causes tooth loss, and how common is it?
Tooth loss generally, I think, like we just mentioned, periodontitis. As periodontitis accounts for like 70%. 70% of tooth loss worldwide is caused by periodontitis. So you progress from simple gingivitis, and you affect all the surrounding structures of the teeth and begin to fall off. And there's some people have certain syndromes that make them have that. So that is a different category. But generally, gum disease is the chief culprit, as well as if you have cavities and that leads to abscesses, that is one. And you also have trauma, sports, accidents, just trauma, and you could also have as a result, they take out your teeth because they are trying to remove a tumor. I've seen folks who have lost all their teeth because the tooth is in the area where the tumor is. And in trying to take the tumor out, we have to take the tooth out. So all that. So you have periodontal disease, gum disease, the chief of them. You have just cavities, and generally, and you have trauma. And then you also have other conditions that folks have, several risk factors, hypertension. I try to, today I'm actually doing a study on dementia and tooth loss. We've been doing, so there's so many other factors that people have been looking at to see some causality between other things going on, not being able to sleep and tooth loss, so many other problems associated with it.
All right. So I think that segues into cancer, Dr. Hewlett. He mentioned sometimes, in treating cancer, patients may have tooth loss. Now, does cancer affect the teeth or the mouth, or the structures within the mouth? And I know cancer is a big topic, but just an overview of if that happens, and how does that present?
Yes, it does. And it's usually in the mouth. It usually will present either on the tongue, on the floor of the mouth, on the lips, around the tonsils, in the pharyngeal area. Cancer does present in the mouth. And over the years, we realize an increase in the number, and it's sort of edging up. Now, that's also important because it has been found to be associated with the human papillomavirus, or the HPV virus. And so because of that, we are seeing an increase in the number of our cancers. And unfortunately, when it comes to oral cancers too, it's a very silent thing, and it spreads really fast, and is not as susceptible to chemotherapy, radiation therapy as the other cancers do. So because of that, it's recommended that we ourselves should have a high index of suspicion by looking out for certain things and also making sure that we are preventing them. One of the key things we say is avoid smoking, alcohol excess, because those have been noted to be predisposing factors. Like I mentioned, HPV is also very important. So now we have the vaccine. People are encouraged to be vaccinated. Those are some of the things we need to look out for. And generally, certain habits. Oral hygiene is also very important. Irritation in the mouth. Once we keep those things, they become predisposed factors in the mouth. But how do you spot it? Like I said, it's usually a very silent thing. And by the time we are seeing it, it's so advanced that treatment is not as effective. So look out for, it could be a whitish lesion. And this whitish lesion you may see under your tongue or even on the surface of the tongue or in the cheek area. You need to look out for these patches. It may also be like a red patch or a sore or an ulcer. Once you've seen a sore in your mouth, and usually you expect that a sore in your mouth should heal after a week or two. Once you're seeing a sore in your mouth that is not healing after 2 weeks, it's time to see a dentist or somebody to have a look at it. You may even have a nodule or a little swelling. It may not even be in your mouth, but it may even be in your lymph node areas. If you find a node somewhere that doesn't feel right, let somebody check. It's better to go to the doctor for them to say it's nothing than to realize it's more than expected. So these are some of the things that we need to look out for, but it's very, very real. It's on the increase. And then let's look out for them and be suspicious and seek help when we find them. Thank you.
So let me ask a follow-up question to both of you. Are these cancers more common in the developed countries versus developing countries? Or, I mean, how is it how common is it in different parts of the world?
I would say, recently they've started asking, especially females to have a vaccine. So if you have the vaccine, so it's reducing this way. But I know I don't know the exact numbers right now, but I think it's on the increase. It's on the increase around the world. We're beginning to see that we have even instituted oral cancer screening in all our exams. So every patient that we see, though it's kind of optional because they have to pay for the screening. But it is now like you have to screen. Let's say we told you about a white lesion or something that you need to take care of. But I don't know, Dr. Hiller, what are you experiencing?
In Korle Bu, the numbers are increasing. We used to see there were cancers that you used to see once in in a year, you see very few. But now the numbers are really getting larger and overwhelming. And unfortunately, we are seeing them towards the end where they've kept the swelling for so long that it's a huge thing that you can't do much. So I think we should educate people about it and ring the bells and also be looking out for it ourselves. But the numbers are really increasing. Unfortunately, HPV vaccination in Ghana is not very. It's I think maybe it's just the at-risk people who have access to it. But that's one of the things that we need to look out for and highlight. Thank you.
So would you recommend that everybody gets the HPV vaccine? I mean, in anticipation of preventing some of these cancers in the mouth?
I would seriously recommend it because even the research done by some of our residents here, I've seen a huge association with HPV in quite a lot of our cancers that we are finding here. And the cancers, some of them are malignant, the tumors, some of them are malignant and some of them are not. But even with those non-malignant ones, some of them are. So I think I would highly recommend the HPV vaccination.
Okay. So moving on, Dr. Uvo, how often should one visit a dentist? And for those who don't have access to a dentist, what are some strategies that you can give them, to help maintain their oral health and then also to prevent some of these diseases that we've talked about?
I mean, it's been advised that you should visit your dentist at least twice a year. That is, I know we're talking about different parts of the world. Dental insurance is not usually is something you have to buy separately. So you see, it becomes more difficult for people, especially those who even work, to purchase. They have medical insurance, but they don't have dental insurance. So I think visiting your dentist twice a year, it should be, but or at least once, at least visit your dentist. I would say at least once. You should find a dentist to take a look at your mouth at least once a year. Hopefully, we can, do something. But there are many places where there's no dentist. Where there is no dentist, what can you do? I mean, this is where disease. This is how disease. We need to increase, care. I find a way to do outreaches, because that's all some of our people have. That the dental outreach they found 1 year is what saved them, because this is not available. Most governments are not, spending money in terms of infrastructure and the staffing. How many dentists are needed in Ghana? In terms of, you look at the population, the number of dental schools, they cannot even produce what the population needs. So we've got to find a way of using technology to make people. So I'm thinking about, we're working on an application where you can take a photograph of whatever lesion and send it to a center where somebody can read, because it is most people don't have care. I mean, I wish I could say, oh, this is what you should do. We're saying you should brush your teeth. What if you have a lesion and you stay somewhere in Koforidua? So how are you going to get across to help? If you don't have money. Well, most of our hospitals, obviously, we have free. I don't know. Do you have free dental access in Ghana?
Yes, the NHIS takes care of some conditions, quite a lot of conditions.
Yeah, because as I travel around, it's just impossible. It's one hard thing. And hopefully keep it clean. If you see something, they obviously, people go to the hospital once things is beyond their hands. So when they see that this is life-threatening, they have to find the money. So if you find something small, pay attention to it and let somebody take a look.
So for example, in Ghana, Dr. Hewlett, how do people who live kind of in remote areas where there are no dentists, how do they get dental health care? Do you guys do some outreaches, or it's just on them to figure it out?
Okay, so we do some outreaches, and now there are a lot of, apart from the dental school doing outreaches, even the Ministry of Health itself has some vans that go out to provide dental outreaches. Thankfully, over the past few years, we've trained a lot of dentists who are also being hosted to the hinterlands. So I think dental health generally has improved in the past few years. However, there's a lot more work to be done. There's a lot more work to be done. And private people too have sometimes come in to help out. So now, at least, generally, the northern sector, mid-belt, southern sector, there are places where people can go to. The rest of it is finance. Either because even if the NHIS takes it, sometimes even the people just taking transportation to those areas is a challenge. However, for me, it's not even the cost, the finance that's an issue. A lot of the times I realize that some people don't even the knowledge or the know-how to say this is a problem, so let me seek help is the most important factor, and not even the finance itself. Most people may see, like I said, a whitish patch, or they may even have a hole in their tooth, but they feel like, oh, my grandmother or my mother has had this hole throughout and never really went to a dentist, and for them it's normal. So I think education for me is most important, because when you are educated and you are empowered, finance is the least of. Well, you can look around. There's also now NHIS that's taking care of some of it. But you even acknowledging that this is a problem in the first place is for me, I think, is one of the key things in they seeking oral health care.
So that is my older brother writing, thanks for the education, never heard of cancer in the mouth. So hopefully now you know. So moving on. We kind of talked about it a little bit when we talked about the toothpaste. So Dr. Hewlett, we see on TV, especially here in the United States, a lot of adverts about whitening of the teeth, and all kinds of products that people sell. Is that effective? And is it really necessary? What are some cautions that people should have when they think about whitening their teeth?
Okay, so cosmetics has become a huge industry now, and people have become very conscious of their aesthetics. So aesthetics is going to play a very huge role. And whether we like it or not, people worry about they having white teeth. So it's understandable. It depends on what it is on the market. I've always said that it's better to seek professional help to make sure you're getting the right thing, to do it the right way, or else sometimes you may suffer some consequences. The teeth by themselves are not white. So if you look at your mouth, you find a lot of the time people getting worried. My teeth are not white, they are yellowish. The natural tooth is not white. It's usually within the range of between white, gray, light bluish, yellowish. So it's like a range. So you may not get it white. For some people, they may have genuine issues. For example, their teeth are naturally dark or stained. So for those ones, it's professionally, you can actually lighten them or whiten them or bleach them. Sometimes the ones that you find on the market, they are just whitening things, and they are also important. What they do is over time, when you eat, drinking coffee, tea, some people smoke, wine, even our regular meals, sometimes people are having the palm nut soups and all of those. They tend to discolor or stain the teeth a bit. So the whitening also sometimes helps. But like I said, it's always good to seek professional help because sometimes some of them may have complications because these are issues where you're using chemicals and the chemicals are doing the whitening. If you look at your regular dress, like a white shirt that has stained and you want to bleach it, compared, it's something like that. So it may have effects. So what are some of these effects? Sometimes with extreme bleaching, you may remember we're talking about the internal tubules and they opening and you getting sensitivity. You may have that with the bleaching. Sometimes to some, because it's a chemical you're doing, it may cause irritation of the gums. And those are some of the complications that you can have with it. Sometimes too, you may have had fillings or crowns in your mouth along your teeth. Those won't bleach with your bleaching or your whitening. So over the whitening, after the whitening, you realize that your teeth are slightly whiter than your crowns or your fillings. And so you have sort of like a multicolored thing in your mouth. But those are some of the complications that may arise. But I would say, though they are effective, if you have a challenge, see your dentist, and they would be in a good position to recommend what it is, and then they can be able to advise you on the best way to go about it.
Thank you. So Dr. Uvo, how about dentures and implants? We see kind of as people get older, we see that they get dentures and some people have implants. Can you kind of take us through what those are, the different categories and who needs what? Oh, you're muted.
So when you have a complete loss of your teeth, or you need to be able to function, sometimes the teeth is taken out so that you can get a better set, really. In terms of if you have gum disease and everything is floating and nothing is in bone, then you become a candidate for, or maybe you had an accident that you lost most of your teeth, and so we need to replace. So we're trying to replace your teeth to form and function. So you have removable options and you have irremovable options. So today, the use of implants are giving us the opportunity to give you, options that you don't have to remove necessarily. So you can keep the tooth back in your head. You lost your tooth, we can put your tooth back in terms of in different forms. I break it down as such. So to get an implant, you need bone and you need money, So if I see a patient and the patient comes in, I see bone, I give God all glory. Then I ask him, do you have money? Because this is quite expensive. One tooth, it's expensive. You see it on TV, Clear Choice, $40,000-$50,000, they give you a new set of teeth. And you go home and you just live with it. So those are options. So you have removable options, which we have always learned about, which is complete dentures. So you have a plate in the top and a plate at the bottom, and you take it out at night when you go to sleep. Then with implants now, you don't have the opportunity of putting a certain type of post in your mouth, and they are all connected, and they give you your smile back in different materials, acrylic or porcelain. Today we are going for porcelain because it lasts longer, and it satisfies. People are able to eat, chew, and people are going. Somebody came and we needed to go for a wedding. He said, "Look, I need teeth. I don't want to go and start taking it out." Somebody said, "I want to go skydiving without fear." And so these options are there. And obviously, if you have bone, if you are healthy, not everybody's healthy enough for some of those procedures. Some people don't have bone at all. So there's bone augmentation surgeries that are done first, then, or even alongside the implant. So those options are there, removable and irremovable dentures. So implants, and on implants, you also have removable, where it is an overdenture. So it's hanging your implants, now create a post for you to put a removable appliance in the person's mouth. But most people really want the one that they don't have to take out. And if they are a good candidate in terms of the bone and their health and obviously the finances, then that becomes a very good option.
So I'll come to you, Dr. Hewlett, about the dentures and implants as pertains in Ghana. But I wanted to ask this as well. So sometimes you see people, that they have a certain kind of teeth configuration. Then the next time you see them, like they have the so-called perfect aligned teeth, white. It looks like they went and somebody stuck over teeth on the teeth. Is that a thing, and what is that, and what's its purpose?
I see that tooth over some kind of, it's just a cosmetic thing, that so they don't do any preparation on the patient's teeth, so they don't prep the teeth for anything. So you just take an impression, and it's called snap-on smile. So I mean, I don't practice that though, but some people, they're like, I can't afford all this big work you're saying. I just need to snap on. I need to go for a wedding. I need to hang out with my guys. I need to snap on. So there's decay, there's all kinds of things underneath, and it snaps it on, and just, or maybe they had they needed braces and didn't have it, and like for the first time, they're able to get something. It works for some people. But I've never really, my patients I have a patient who've had it, and she's like, I'm like, I can't make another one for you, but obviously some folks thrive in that. So many dental offices, they're making a ton of money just doing that for people. It is not dangerous, I would think, but I would say if you are neglecting decay, you are covering up gum disease with that stuff, not very advisable, I would say.
Dr. Hewlett, you want to address that, and then dentures and implants, like?
Yes, I agree with everything he said. Just to add that in Ghana, unfortunately, implants are increasing, so people are getting more aware. The only thing is that it's a bit more expensive, and so not everybody is able to afford those. However, now we're having other materials. So there are acrylic dentures, there are Valplast dentures, there are metal dentures. People now have a lot more variety as to what their options are. And so it's quite good. At least it's no longer attractive to be walking around toothless.
So Dr. Uvo, you were talking about these snap-on things. Are they permanent, or the patient can take them off?
It's just like a bleaching tray. It's just like the stuff that these kids wear for sports. Okay. It's like a mouth guard, but it's done to line up with what you already have, and the occlusion is still pretty much okay. So it's just like something you take off at night. You just snap it off and put it by the side. You want to go out, you put it on. Yeah.
Okay, so that's more like a retainer that you get sometimes after you get your dentures out.
Yes, yeah, but this one it's tooth colored. Okay. And it looks really nice. You can't even tell that person. Okay, if you knew the person before, you'd be wondering how come.
Yeah. So as we come, closer towards the end of the broadcast, I want, each of you to at least tell us about, I mean, if there's something we haven't covered, you can cover it. And then also kind of your take-home points about, you know, why it's important to pay attention to our oral health, and, you know, things that are important for everybody, you know, to do when it comes to our oral health. So maybe I'll start with you, Dr. Hewlett.
Okay, so just to emphasize all we've talked about today, oral hygiene, oral hygiene, oral hygiene. Dr. Ovo was talking about this animal called plaque and its effects. It has a huge damaging effect. And so one thing I would say is let's make sure that we are getting rid of it every day, brushing, flossing, whatever it is. No matter how difficult it is or how expensive it is, if we can make an appointment with a dentist or visit a dentist, even if it is once a year, it would help a lot. There are compromises we need to make. I'm sure we can sacrifice a dress or a shoe or something and take care of our oral health. It may be very important. One thing I also want to highlight really, really, really with this talk is the fact that the mouth has a huge impact on the general body, and the general body also has a huge impact on the mouth. And so as we neglect our mouth, it affects our body. For example, Dr. Ovo was talking about periodontitis and gum. These infections spread to the rest of the body, and it can lead to complications. I've seen people die out of just a toothache. It was an abscess. They didn't deal with it. It spreads. The patient is dead. Or you have things spreading to the rest of the body that does a lot of damage. So I will encourage that we don't highlight it enough, or a lot of the times we don't see it as important enough, but it's a silent killer. Unfortunately, our populace, a lot of the time, so long as there's no pain, we're okay with it. Or even if it is painful, oh, it's toothache, it will go away. And so we don't seek attention. So I think let's put more emphasis on it, and let's make a lot more noise about it. And let's seek help when we have these. Thank you.
I just wanted to say that, you know, a good oral health is not about just a beautiful smile. It's a connection to several other things. So a lady comes into the clinic, she's pregnant, and she has gum disease. And it doesn't end there. The child that she has, she gives birth to that child premature because she has periodontitis in her mouth. So periodontitis has been connected to low birth weight in infants. You know, so what you have in your mouth, you are transferring to another generation. You know, so I think let's take care of ourselves and take care of our children. You know, sometimes you say, oh, they're still kids, it's just baby. Is that thing called is just baby teeth? That's the most annoying thing I've heard all my years of doing dentistry. Leave it alone. So people who have access to insurance, they have access to help, especially on this side of the world. I cry every day when I see that there's no utilization. People who have access to insurance are not using it for their children because they say it's baby teeth anyways. It's gonna fall off after some time. We've seen children die in America because of toothache that was not attended to. People have lost people. I know people who have died from complications of toothache, something that could have been prevented. It was a preventable death. And somebody was saying, well, it's time to go. I said, that's not the time for her to go. That was a mistake. It was preventable, and we can do something about it. You know, brush your teeth, check your child. 12-year-old, when his child is up to 12 months, you take a look, let him visit. Today, physicians are allowed to apply varnish. Physicians who are not dentists are applying varnish for children because people are likely to see a physician to see a dentist. So whatever we can do to increase the quality of life of our people, let's do it. Thank you.
Okay, so we still have a few minutes, so maybe something that we didn't really address, we can quickly address it. So I know, Dr. Hewlett, you mentioned halitosis at some point when we were talking about kind of brushing the tongue. Can we just briefly talk about, kind of smelly mouth? What are the causes, and what are some things that people can do to get rid of that?
So it's an unpleasant smell, odor coming out from the mouth, and several causes. Majority of it is because of this whole plaque thing. Once there's bacteria and the plaque, they have gases, they exhibit gases, and it smells. And generally, we tend to have, it happens to everybody. Maybe you wake up in the morning, your mouth is not that fresh. But when it's persistent, then there's cause for alarm. And it's mainly either you haven't removed the plaque, or sometimes the decay we talked about. There will be a hole in there with decay in there, and the decay harbors all of this bacteria, and in all of that, it smells. There may be mouth sores or mouth ulcers, it may smell. Sometimes too, even our diet, some people tend to eat foods that maybe garlic, onions, whatever it is, it tends to give you those mouths. Some people also have some medical conditions that predisposes them to halitosis. So, for example, there's a medical condition that makes them get out certain gases. That's that. Some of it too may also be in the oropharyngeal area or in the nasal area. Some people may be predisposed to sinusitis. So it's a huge bevy of things. If you are brushing well, you're seeing your dentist, and it's still not solving, you're cleaning your mouth and you're doing all the right things, but it's still persistent, see a professional. Sometimes over time, we realize some people, it is just in their head. They feel like they have halitosis, but they may not have halitosis. So one of the things I always say is, validated by somebody close to you. Do you think I have a funny smell in my mouth? And I also say, let's be each other's keeper. When you feel that somebody is not smelling too good out there, it's maybe difficult to actually tell the person. But one of the things you do is Christmas time, book an appointment for them to go see a dentist as their Christmas present. That may be a very nice way of indirectly telling them that it may not be smelling too good out there, and have a professional check.
Dr. Uvo, you have anything to add to that?
Like we said, there's some cancers in the mouth smell in a certain way. The folks who take a multiple medication leads to, it causes xerostomia. So many drugs that people take for high blood pressure or whatever, they causes the mouth to be dry. And once the mouth is dry, then the smell, so it just might be showing you that there's something wrong somewhere else. So if you notice it's better to investigate and make sure you rule out everything that Dr. Euler just mentioned, and to find out maybe it is leading you. Does your medication need to be changed, or do you need to take some adjuncts? Do you need to take something to make your mouth drier? Do you need to drink more water? Because sometimes, if you're taking medication for your blood pressure, you're not going to stop taking those medication because it's causing xerostomia. That is the least of your concern. But anything you can do to make sure your mouth is hydrated would help in reducing halitosis. But I think it becomes a very embarrassing thing, because it's really distance. So if you're not very close to someone, sometimes it's better to give somebody a healthy distance, because anybody might have it. Because if you wake up and you didn't rinse your mouth in a certain way, you don't know. Well, I want to thank God for COVID, because with COVID came face mask, and with face mask, those things are just there. Everybody keeps their own something to be thankful for. I mean, you guys wear face mask every day at work, but after a while, everybody was wearing it, so people keep their stuff to themselves. But that's just true.
So thank you so much, Dr. Hewlett and Dr. Onorobi. I think we've had a very educative time talking about oral health, and I think if we didn't take anything out of this, what you can take out of this is that your mouth is an indicator. It's a barometer, or it's a something that indicates what's happening in the rest of the body. And so I made a statement that as your mouth goes, so the rest of your body. And I think we've addressed that your oral health can affect the rest of your body. And not only that, it may be an indicator of something else going on. And so it's important for us to pay attention to some of these things. Share this video with your friends and your loved ones, because as we've heard, it's important, and we need to pay attention to our oral health, and to make sure that we are living a healthy life. God has given us this body to be stewards of it, and we are supposed to be good stewards of what God has given to us. In fact, in Corinthians, it says that, our bodies are the temple of the Holy Spirit. And if we don't take care of it, God is going to destroy us. I mean, and so as we talk about these topics, it is to give us knowledge and understanding so that we will do right, and help each other to be healthy in our bodies. Now, we thank you all for listening. And I would like to thank Dr. Hewlett and Dr. Onorobi once again. And hopefully we will come back again next month with another informative discussion. Next week, we will go back to the regular wisdom conferences. Thank you all, and God bless.
Thank you too. Bye.